Gentlelady. With that, let me recognize the gentlelady from Indiana, Ms. Pilarski, to inquire.
Thank you, Mr. Chairman. And I just wanted to add, I'm excited and I think this has been an incredible panel today. I thank all of you for coming, for what you've shared, and I'm excited and looking for a bipartisan solution that we can actually come to the American people and solve this with working together, and I think that's very possible. And Dr. Miller, I just wanted to thank you for bringing up that issue of the patent thickets. I was going to bring this up, and you did right before the break. The issue where a company claims any kind of a number of patents on a drug to use it to stop competition from coming into the market. I was going to bring that up. I just wanted to say thanks for doing that, because there's a drug that I have been familiar with in our district, and it's called Revlimid. I don't know if you've ever heard of it. You're all shaking your heads that you have. And, you know, just to add, I guess, how devastating, and to your story, ma'am, just how devastating when you're in need and you find yourself in need, then you find yourself not being able to afford what is out there because of these patent thickets that are walls behind walls behind walls that never bring these drug costs down but only increase them. And in this case of Revlimid, it was in the market in 2016 at $6,195 per month. Now it costs over $16,000 per month. Not that either were tolerable, but just as an example of what happens when things increase behind all these walls of patents. But Dr. Antos, I just wanted to ask you very quickly, you know, we all remember when the ACA took the benefit away of being able to pay for over-the-counter medications through the different kinds of health insurance plans, flexible plans, health reimbursement plans, medical savings accounts, and it seemed to have taken away, or it actually put in a barrier now. So if you're trying to shop around for drugs, you want to buy over-the-counter, the restrictions on HSAs are causing families to spend more money out of their own pockets and on their overall health. According to the Consumer Health Product Association, every dollar spent by consumers on over-the-counter medicine saves the U.S. healthcare system $6 to $7, contributing to $102 billion in savings each year. Last Congress, the House passed H.R. 6199, the Restoring Access to Medication and Modernizing Health Savings Account Act. This bipartisan bill would have allowed non-prescription drugs and female hygiene products to be considered qualified medical expenses for all of those HSAs, MSAs, FSAs. Can you give some other common sense ideas, ways we can incentivize patients to use lower drug costs, such as those over-the-counter products, instead of having to take brand name prescriptions all the time? Are there any changes you could see that we could make to HR 6199, or ideas you have to just continue to incentivize lowering the cost? Can you turn your mic on? Thank you.
Certainly you're correct that if you were to buy aspirin at the CVS, it would be much cheaper than if you were to buy it as a prescription drug. And there are plenty of examples like that. The HSAs are generally limited in any event. I would raise a broader question that goes beyond drugs. The issue that I see is that we're tied to having to come up with a receipt. So this ties us to the fee-for-service system if you have an HSA. And there's a more fundamental inefficiency there. But you're certainly correct that the impediment, to the extent that people are aware of this, I'm not sure that they are, but the impediment to using your HSA money for appropriate over-the-counter medications does add to cost.
Thank you. Mr. Chairman, I yield back.
I thank the gentlelady. The gentleman from Pennsylvania, Mr. Boyle.